20 minutes isn't a great deal of time to talk about mentoring, but I will do my best. Like everybody, we've had to rush through our presentations today, but hopefully you'll know a little bit more when you walk out the door than you did when you walk in. I'm sure that's the case. So, what is mentoring? It's a very broad question. Who's been mentored? Has anyone been mentored? Mentoring is viewed, definitely in a positive light, and that it's a valuable thing that we receive from somebody, or that we impart to somebody. So it's seen as a very positive thing that we can do. There's not a lot of formal mentoring opportunities in primary healthcare at the moment, but I think that's something that's about to change. So definitely be watching this space. Obviously, it can be strategically valuable to organisations and companies. So you can have strategic mentoring on an organisational level, but even if that is the case, and it is done on an organisational level, it is always personally beneficial. Now, it's used for a variety of reasons. It's been used at an organisational level to make workplaces safer, and also as a result of those strategies and that mentoring, it often increases the profitability of those organisations as well. So, what is not mentoring? What is mentoring not? It's not training. That's not what mentoring is, and it's not supervision. And sometimes those terms get confused. Sometimes people think that that is mentoring, but it's not. That's definitely not what it is. Mentoring is, however, a light bulb moment that is created more frequently using conversations that create insight. Now, this can be done informally, at a social level, when you're out with friends, at work, when you're just having conversations in the tea room or in the corridor, on a bus with strangers, on a train. I mean, I had a bit of mentoring from the radio the other night when I was driving in here, listening to, and you might have heard me mention this already, but it was organisations, community organisations that raise money for people less fortunate, like the Salvation Army and Rotary and places like that. And they were talking about the cost of administering that and what's fair and reasonable and what isn't. So that was a light bulb moment for me, just listening to that conversation on ABC radio. So it can come from, a number of places. It doesn't just have to come from one place. Mentoring is a relationship with someone that allows you to think about the future by discussing the possibilities, the alternatives, and the choices, and then providing you with feedback as the mentoree. Again, it can be formal, so it's something that's deliberately designed as a group or a one-on-one conversation with specific relationships. So that's another type of mentoring as well. So you've got your informal type of mentoring and you've got your more formal strategic type of mentoring. Either way, it's mentoring and it's beneficial. Oh, look at that, sorry. I held my mouth the wrong way then and it did something funny. Okay. So again, the job of the mentor. It's to elicit and to impart information. But how do you do that as a mentor? What is it that you do? There's 2 rules to remember, really important rules. And if you take nothing else away from what I'm saying today, these are 2 good ones to remember. Ask before you tell, and listen before you speak. Anne Roth is the woman that said that, and it's really important. So if you're mentoring somebody, you really, you can often feel very enthusiastic about it, and before you know it, you're saying all sorts of things to people and you're not actually giving them a chance to speak. So if you can, rein it in and ask them before you tell them, and have a good listen to what it is that they have to say to you before you open your mouth and actually speak to them. And that's part of that relationship building and getting them to engage with you as the mentor. You need to take a bit of a strategic approach if you're going to do mentoring in a more formal way. Again, I'm not going to run through this table at length, but Anne Rolfe again has a mentoring website, and this is one of the resources that is on her website. You can Google her. And there's also, I went the wrong way, sorry. There's a learning cycle that relates to mentoring as well. The reflection of their experience, making informed decisions about what they do, and taking actions that are creating a new experience. So we're talking about growth. You may have been in on one of Stuart's sessions, and we talk about that comfort zone that we're in, and then the next level out is your growth zone. So that's where we want to go. That's where we want to be taken with mentoring, is into that growth zone where we learn more and we understand more. So that's the zone we want to come out of, our comfort zone, and into that growth zone. The individual mentoring cycle must be tailored to suit the person that you're mentoring or the organisation that you're mentoring. You've got to engage people. By doing this, you need to have meetings. Make sure there's an agenda. Get the person that you're working with to create their own agenda. Get the team to create the agenda with you. Don't just go in there with your own agenda. Make sure that there's been input into that agenda so that they feel as though they've got they're playing some sort of part in what it is you're doing. And sustain it. So make these meetings regular. Have a schedule. Have a room that you do it in, that sort of thing. And do it regularly. Make it a priority so that it becomes a habit. Once it becomes a habit, then you're embedding it, and you can achieve some amazing, amazing results. So ask yourself these questions. Where are you now? Where do you want to be? How might you get there? And then after some action, after you've done something once you've asked yourself all of these questions, have some reflection on what you've done. And reflection's been a topic over the course of the conference. And it's something that nurses, sometimes we do it, we don't realise we're doing it. Sometimes we need to make an effort to do more of it. Because without reflection, you can't really have a really good understanding of what it is you're doing and what you could possibly be doing better. So reflection's a really important part of mentoring, or being a mentee as well. Take opportunities as they present themselves to you. Make a conscious decision to surround yourself with people who you admire, you respect, you understand their knowledge. Albert Einstein, I think Anne Rolfe said Albert Einstein had mentors, because you don't know everything about everything, and it's about building those relationships that creates that change that you need to go through. And those people that you surround yourselves with can provide you with support and encouragement and stimulate your ideas and your thinking. So in summary, it's all about the conversation and the relationships that you have with people and that you form with people. If you can have great conversation, form great relationships, you'll stimulate your thinking, and that's what mentoring is for me. And I just wanted to let you know that as part of the nursing demonstration projects that have been referred to again a lot over the weekend, and I'm actually a part of one. There's a group in Tasmania, one of the Medicare locals there, are just doing some fantastic stuff at the moment around mentoring. So watch this space. We'll be hopefully creating in the future sort of a database of mentors and a resource for people to be able to access, and moving that forward. And we can't do that without your input. So speak up and be heard and get involved. Thank you very much.